For today's video, we're going to be talking about several special tests or provocation tests that we use around the wrist and hand when considering involvement of the median nerve. The first two that we're going to begin with are some of the more well-known tests, and they are positional provocation tests, known as Phalen's and reverse Phalen's. Now, Phalen's is where we begin in order to exacerbate or provoke the symptoms. And so if we were expecting the individual to be having a pathology or symptom provocation on the right side, that's going to be our reference limb as we go throughout these tests. We're going to demonstrate Phalen's to begin with. And so what they're going to do is they're going to come into wrist flexion, bring the back of their hands together, and then they're going to come up to maximally compress and flex here at the wrist joint. Now, this test is a time test, and so typically we would want our patient to hold this for a minimum of 30 seconds up to a full 2 minutes. Specifically, we're looking for the reproduction of signs and symptoms or the comparable sign. Now, after this test is complete, and if the individual does experience symptom exacerbation, we then can move into the second part of this test, which is reverse Phalen's, where they're going to bring their hands together as if in a praying motion, and then depress into a wrist extended position. Again, this position now is held for 30 seconds up to a full 2 minutes, and it's seen as a symptom alleviation as we are now kind of opening up the carpal tunnel. So again, began with Phalen's, we then move into reverse Phalen's, otherwise known as praying Buddha. The third test that we want to talk about is a median nerve compression test. The median nerve compression test is where we isolate the median nerve within the carpal tunnel. And so for the carpal tunnel, we first want to identify our radial and ulnar styloid processes, and then move just distal to that to find the carpal tunnel, as both of those structures will serve as attachments for the retinaculum that serves as the roof. At this point, we're going to use both of our thumbs, one proximal, one distal, and we're going to provide sustained compression to the carpal tunnel for 30 seconds. A positive test is going to result in the numbness onsetting or the reproduction of the symptoms for which the patient is presenting. A similar test, and our fourth test, is what's known as Tinel's test or Tinel's sign. Now, you may be familiar with this, as Tinel's is used in a number of locations throughout the both upper and lower extremities and is a compression test. I find that using a reflex hammer tends to elicit the symptoms a little bit better than your actual finger. And so if you use a reflex hammer, what you're going to be doing is, again, targeting the carpal tunnel and tapping repetitiously for anywhere between 10 to 15 repetitions. Again, a positive test would be one where the symptoms that the patient is presenting with are elicited, or the reproduction of the comparable sign. Finally, our last test is what's known as the flick sign, and it's not even so much a test as it is a maneuver or a thing that the patient will use to try to alleviate numbness and tingling. And so you can ask if flicking the wrist, almost as if they're flicking a thermometer, alleviates the numbness and tingling. And if it does, that's considered to be a positive test. The reason that test is included is there is a CPR or clinical prediction rule on carpal tunnel syndrome that has been put forth, which includes the flick sign as part of one of several descriptors for ruling in or out the presence of this pathology. So, 5 tests or provocation signs and symptoms for the median nerve specific to the carpal tunnel. Have a go with a peer or colleague and let me know if there's any questions.